Yes, first of all, I'd like to thank the committee for having selected our abstract today. I have nothing to disclose. So our main aim is to recreate CLL microenvironment in vitro, and to do this we are exploiting a benchtop 3D bioprinter. Our bioprinting strategy consists first in collecting the leukemic cells, either CLL cells alone or together with the stromal and endothelial cells. Then we mix the cells with the proper bioink, which is a smart material made of alginate and gelatin, specifically designed to support cells' movements and functions, as well as high printability. Then we define the printer nozzle dimension and the geometry and the feel of the scaffold that we want to print, and that we finally 3D bioprint with a 3D bioprinter which works with an extrusion pump. Then the resulting scaffold will be cross-linked either with UV light or with a chemical cross-linking agent, and eventually will be placed in static or in dynamic condition for cells growth. During the last year, we managed to set up all the protocols for the analysis, such as viability assays, flow cytometry, imaging, real-time PCR, Western blot, and drug treatment. So first, we started by analyzing the viability of a single cell type. Specifically, we analyzed the CLL cell primary cells viability in the traditional two-dimensional culture, and as we expected, we observed a decrease in their viability starting from 3 days to 7 after the culture. On the contrary, in our three-dimensional structures, we observed a sustained viability compared to the traditionally two-cultured cells. As you can see from this live and dead assay, in which we can still detect green viable cells after 28 days in the three-dimensional culture. We confirmed this data with a metabolic assay showing again a sustained viability of our 3D structure. Then we also treated the two-dimensional cells, the cells in the two-dimensional culture with the chemotherapeutic agent fludarabine. And we observed, as we expected, that their viability significantly decreased 72 hours after 72 hours of treatment, while for our three-dimensional structure, our 3D bioprint, the CLL primary cells, show a higher resistance to this same drug treatment. It would be interesting to look at longer time points. Since our final goal is to recreate a more complex three-dimensional system with this method, we decided to print more cell types at once. In this case, we use CLL cells together with the cells of their usual microenvironment, such as lymph node fibroblasts and endothelial cells. So this is a three-dimensional reconstruction of this mix that we 3D bioprinted, where you can see that there are the red stromal cells creating a kind of a tissue-like structure, while the GFP-positive CLL cells are growing in niches among them. So summarizing, we can say that our 3D bioprinted CLL primary cells are homogeneously distributed in the scaffolds and show a sustained viability, making of this the first long-term culture for CLL by using the 3D bioprinting. 3D bioprinting, we can conclude that is an innovative technique which allows to print different cell types at once in order to better study the native disease microenvironment with all its inner interactions and eventually also the response to drugs. In parallel, we are also working on the dynamic growth in a bioreactor in order to better mimic the physiological settings, thus favoring cell-cell interactions, monitor cell trafficking, and study the response to drugs. I would like to thank all Dr. Cristina Scelzo-Lab and all the members, Paolo Ghia and Lydia Scarfò, and people from CellLink, last but not least, all the patients and all of you for your attention. Thanks.